And now, please welcome Hebrew Senior Life President and CEO, Louis J. Woolf.
Hello, everyone, and thank you, Elisa, for your commitment and your heroic work. I've always placed great emphasis on personal character. I believe very strongly in the adage to hire for character and train for competence. As in any organization, the character of the staff plays a major role in the culture of the organization and how it delivers its mission. Throughout my 11 years at Hebrew Senior Life, I have seen extraordinary examples of commitment and character from our 2,600 staff members. But over the last 8 months, I have seen the most vivid demonstration of that character and commitment. In the area of medical care, most organizations sent their patients to the hospital, which is not optimal for those patients. It can be disorienting, it can be detrimental, and it also is not optimal for what is an overburdened healthcare system. At Hebrew Senior Life, the vast majority of cases were treated by our own staff with expert care, with deep compassion, with great focus on their personalized goals of care. We also emphasized social engagement and activities. We minimized the impact of isolation with a wide array of concierge services and virtual activities. We even helped 12 residents at the Jack Satter House get bat mitzvah along the way, and they were way past their bat mitzvah age, way past. Our researchers contributed to the accumulation of knowledge about COVID-19, with efforts ranging from the inclusion of seniors in testing and clinical trials, to best managing patients with their chosen goals of care, to more recently, vaccine approvals and ultimately the equitable distribution of the vaccine to seniors. And in teaching, at the request of Governor Baker and Secretary Mary Lou Sudders, our staff took a leadership role in the creation and management of an infection control program that had great success educating the state's almost 400 nursing homes on best practices and significantly reducing the infections and the deaths from the virus. And we are now leading a Massachusetts contingent on a similar national program overseeing the work of the area's academic medical centers and other hospitals. Over the course of the last 8 months, I have heard absolute raves about the extraordinary performance of our staff. I've heard it from patients, I've heard it from residents, families, trustees, and government officials. I love talking about our staff, and I love telling our staff about all the praise I hear. But the interesting thing is, as I've talked about this to our staff, they've had a very different reaction. They don't view anything they've done over the last 8 months as extraordinary. They view it as how they always treat our patients and our residents. They're always committed to outstanding care while balancing activities and quality of life and helping people live their best lives. They're always committed to never being satisfied with the status quo and always looking to answer unanswered questions and to spread that knowledge to the rest of the industry in order to help the care of all seniors throughout the Commonwealth and throughout the world. They understand, as Elisa so poignantly pointed out, if not us, then who? More often than not, when I talk to them about the extraordinary care, they only wish they could have done more. With our staff, what's truly extraordinary is not their performance over the course of the last 8 months. What's truly extraordinary is who they are. And that's what makes Hebrew Senior Life so special all of the time. But it hasn't only been about COVID this year. We've actually faced 2 pandemics, COVID-19 and racial injustice. Both COVID and racial bias infect way too many people. And it infects many people who don't even know they're infected and don't know that they're contagious. Both of these things deeply affect our community, and they both affect our very diverse staff. And we're working very hard on both fronts to fight both of these pandemics. At the same time all of this has gone on, we also continue to be totally focused on our commitment to redefine the experience of aging all of the time. As more Americans continue to advance to their senior years at record numbers, with 10,000 people turning 75 every day in our country, and more disproportionately suffering from dementia and financial instability. To address this, we continue to grow our Center for Memory Health. Way too many families struggle with dementia and have nowhere to turn for truly capable and comprehensive care, and we know we can help. And you'll be hearing more about this from Alvaro in a bit. We're also moving ambitiously to expand our senior living capabilities. We have aggressive expansion plans underway for Simon C. Fireman Community, for Senate Communities of Brookline, and several other locations. And our research and our teaching and many other programs continue to grow in size and in impact. It has been a very challenging year for all of us, but in many ways a very fulfilling year for us at Hebrew Senior Life because of the contribution we've made, because of, yes, our extraordinary staff. As we go forward, our commitment to continue to redefine the experience of aging will continue because it is so increasingly relevant and so increasingly important.